Hi everyone, my name is Dr. Kimberly Brown. I'm a licensed naturopathic doctor in California, and my specialty is hormones. Everything from thyroid, perimenopause, menopause, postmenopause, longevity. It's about staying healthy for as long as you can and to feel good. So today I'm going to be talking about perimenopause and how you might know if you are in perimenopause. So just last week I had a patient in her early 40s who thought, I must be too young to be in perimenopause. She was skipping periods, not sleeping well, having awful PMS, and I said, nope, you are definitely in perimenopause. Now, she may continue to have periods for another 10, 15 years even, but she's having symptoms of perimenopause. So how old can you be? Or how young, I should say, can you be? Well, many of us say by age 35, you might start showing signs of perimenopause. Definitely by age 45. 35 would definitely be young. My youngest perimenopausal patient was 35 years old, and she stopped having periods in her early 40s. But the average age is early to mid 40s, and with periods ending around age 52 or 53. Most common symptom, I would say worsening PMS for most women. It can become longer, lasting a week, 2 weeks, and more severe. And it's not only more painful periods, more often it's more emotional distress and insomnia. So problems with sleep, that's another perimenopausal symptom. Having difficulty falling asleep, busy brain. Definitely stress makes it worse. Stress makes everything worse, but there's actually a hormonal interplay there. And anxiety can increase. I've been doing this, I should say, for about 15 years. One of my first patients had come to me. She had had a hysterectomy in her 30s, and she'd been given, by the time she reached her 40s, she had been given drugs for severe anxiety. And she said to me, it's cyclical. It feels like it comes, it goes. And I thought, yeah, you're in perimenopause. And she had no progesterone. Gave her progesterone, bioidentical progesterone. She felt great, and she was able to go off those anti-anxiety meds. One of the first hormones to drop is progesterone. Second one would be testosterone. So another symptom, lower libido, no interest. Oddly enough, I've seen some perimenopausal patients given estrogen, and that's often a mistake. Not always, because another symptom can be hot flashes, and your estrogen, it's going up, it's going down. But that's typically a late perimenopausal symptom, and late 40s, early 50s. But sometimes younger women can get that as well. But we have to be really careful with estrogen, because oftentimes the problem in perimenopause is too much estrogen, and that actually contributes to anxiety. It's like the body's, you're more likely to have, to ovulate more in perimenopause because of that high estrogen. I was going to say it's the body's last-ditch effort to get pregnant, so hyperovulation, high estrogen. Thyroid disorders. So hypothyroidism, it's the most common. We do see hyperthyroidism, far less common. So whenever there's a change in the sex hormones, which occurs in perimenopause, also in adolescence, we see an increased risk of hypothyroidism. So hair loss, fatigue, increased anxiety, heart palpitations, joint pain, decreased metabolism. Certainly there's some overlap with the sex hormones, estrogen, testosterone, progesterone, but it could be thyroid issues. So I always test my perimenopausal patients' thyroid to see what's going on there. Now, treatment. I did talk about estrogen and how I have seen some perimenopausal women given estrogen and it makes them feel worse. Can cause more anxiety in perimenopause. It can cause bloating and breast tenderness in perimenopause. So how I treat perimenopause is from everything natural, supplements, herbs, diet, to hormones. Oftentimes in perimenopause, we can use targeted supplements, oftentimes to support, to decrease stress. Remember I said stress has a lot to, well, any increased stress causes more perimenopausal symptoms. So if we can treat the cortisol levels, that stress, a lot of the perimenopausal symptoms can go away. If there are irregular periods, targeted herbs at certain times in the cycle will help regulate the menstrual cycle, but also some of the symptoms as well. But sometimes I do find that a low dose progesterone is needed. Now don't do that without the help of a doctor. Dose really does matter, and the way it's given matters. You want to work with a doctor that you trust and a pharmacy that you trust. Testosterone, that's a whole another subject that we'll get onto at another time. The benefits of testosterone. And again, estrogen either has to be targeted. Oftentimes in perimenopause, women will feel this low estrogen causing hot flashes in their periods or right after ovulation. And that's because that's when estrogen drops. During the period or right before the period, estrogen can go really low and it doesn't quite come back up like it's supposed to. So what I will sometimes do with some of my perimenopausal patients is give them a little bit of estrogen during those times to help with hot flashes. That being said, in perimenopause, herbs work so well to support estrogen. Also, we have herbs to decrease the estrogen dominance, the opposite, and herbs to help increase progesterone. A little bit harder with progesterone with herbs, but can be done. I just want to know if any of you out there have questions. You can always message me. Be happy to cover any of your questions next time about perimenopause and any symptoms that you're feeling that you think might be perimenopausal. Take care, be well, and I'll talk to you soon.